Assalamu alaikum. Our lecture today is arrangement of artificial teeth, anterior teeth. Guiding lines assist in arrangement of artificial teeth. The lines used for maxillary cast is number 1, a line drawn parallel to the frontal plane and touches the anterior margin of the incisive papilla. Assist in the positioning of the upper central incisors. Number 2, the midline follows the mid-palatal suture and bisect the incisive papilla. This line is perpendicular to the line drawn before. Number 3, the canine eminence line marked on the cast, if can be noticed, which assists in the arrangement of or positioning of the canines. For mandibular cast, guidelines used for arrangement of the mandibular teeth are number 1, a line is drawn parallel to the frontal plane, bisecting the residual ridge. Assist in the positioning of the mandibular central incisors. Number 2, a point designates the distal of mandibular canines. Number 3, a line follows the crest of the residual ridge extended from the canine point to the middle of retromolar pad. Assist in the buccolingual position of the mandibular posterior teeth. A line that bisects the vertical height of the retromolar pad assists in the establishing the vertical position of the occlusal surfaces of the posterior teeth. This line used to arrange the posterior teeth, which should be not higher than the retromolar pad. Arrangement of anterior teeth. The anterior teeth should be arranged to provide the following requirements. Number 1, proper lip support. Number 2, satisfactory phonetics. Number 3, pleasing aesthetics. Now we explain how to arrange the maxillary anterior teeth. We have certain criteria used to arrange the maxillary anterior teeth. The first tooth is maxillary central incisor. In a frontal view, the contact point between right and left central incisors should coincide with the midline of cast. The incisal edge of each one should touch the occlusal plane. The long axis is perpendicular to the occlusal plane. In sagittal view, should have slight labial inclination about 5 degrees. In occlusal view, the two central incisors should be placed to give the beginning of the curvature of the arch. Generally, the labial surfaces will be 8 to 10 mm anterior to the center of incisive papilla. Second tooth is maxillary lateral incisor. In a frontal view, this incisal edge is about 1 to 2 mm above the occlusal plane, and the long axis shows a little distal inclination. That means the lateral incisor higher than the occlusal plane. In sagittal view, the maxillary lateral incisor should have slight labial inclination about 10 degrees. In occlusal view, the cervical area is depressed more than the central incisors, and the distal edge should be rotated lingually to form the curvature of the arch. The last tooth of maxillary anterior teeth is maxillary canine. In a frontal view, the tip of the canine should touch the occlusal plane, and the long axis is perpendicular to the plane. In sagittal view, the long axis is vertical. In occlusal view, the cervical area is prominent, represents the corner of the mouth and the turning point of the maxillary arch. It forms the transition from the anterior teeth to posterior teeth. Arrangement of mandibular anterior teeth. Also, we have the same criteria used for maxillary anterior teeth. The first tooth is the mandibular central incisor. In a frontal view, the long axis is vertical. Their midline should coincide with the maxillary midline. In sagittal view, should have slight labial inclination. The incisal edge should have 2 mm of vertical overlap, which called overbite, and 2 mm of horizontal overlap, which called overjet, in respect to the maxillary central incisors. Now we defined the overbite and overjet. Overbite, which means vertical overlap, it is the vertical extension of the upper anterior teeth over the lower teeth in a vertical direction, when the opposing posterior teeth are in contact in centric occlusion, which should be 2 to 4 mm. Overjet, horizontal overlap, it is the projection of maxillary anterior teeth beyond their antagonist in a horizontal direction, which should be 2 to 4 mm. The second tooth is mandibular lateral incisor. In a frontal view, the long axis is vertical to the occlusal plane. In sagittal view, should have slight labial inclination. The incisal edge of the mandibular lateral incisor should be positioned behind maxillary lateral incisor 2 mm, which that means overbite, and 2 mm, which that means overjet. In horizontal view, the distal edge rotated toward lingually to have the arch curvature to receive the canine. The last tooth for mandibular anterior teeth is the mandibular canine. In a frontal view, the long axis has slight distal inclination. The tip of lower canine should be placed in the embrasure between maxillary lateral incisor and canine. In sagittal view, the long axis has slight lingual inclination. In occlusal or horizontal view, the cervical area is prominent. The arrangement of anterior teeth should follow the form of the arch, which is either square or ovoid. Thank you.